right, welcome those of you that have joined. We're waiting on a few more participants to come in. It's going up pretty fast, so I would say 1 to 3 minutes here, and we'll be ready to start. Give it a few more minutes for the 20 of you that joined in the last 30 seconds since I said this. Give it another minute or two and let the participant count level off before we get started. Looks like it has slowed down. So I'm going to go ahead and kick things off, and people will, I'm sure, keep popping in, but they'll catch up. So welcome to our webinar on the growing buzz around Medtail. I'm Dustin Schaefer, Chief Technical Officer at Henderson Engineers. My job is focused on the way we work. Luckily for you, we have some experts involved that can talk specifically about Medtail. My job today is to be the moderator, take your questions. Hopefully you have a lot of questions that will make this more interesting, and just kind of manage the conversation around answering a few key questions. As I said, we do have some experts here. We have Jason Woolham, our retail practice director, and Mark Chrisman, our healthcare practice director. Medtail is an interesting thing. It sits kind of squarely between those two sectors, and it requires expertise from both. So we're going to talk today about what is Medtail, why is this a thing, how is this different, and it's going to be conversational with very few slides. So hopefully you appreciate that. I always do when I come to a presentation. It's focused on answering these questions and specifically answering your questions related to these topics. So we'll start with Jason just walking us through what is Medtail, what does that mean, why is that a word? So Jason, take it away.
Well, thank you, Dustin, and welcome to everyone that has joined the webinar. We appreciate you joining. Medtail is the convergence of medical services into retail environments. And although it is not a new concept, it actually is a fairly old idea, but it is definitely an emerging market and something that is growing a lot right now. The first Medtail probably would be the local pharmacy in a grocery store. And it's something that's fairly common today, but years ago, you would go to a medical plaza or the hospital, you would meet your doctor, he would write you a prescription, and you would go to your neighborhood pharmacy or go to the pharmacy that was at the hospital to pick up your prescription. And years ago, there was a level of convenience that was added by adding that pharmacy into a grocery store or into your general goods store like a Walmart or a Target, places where you were normally shopping and going on a regular basis. Adding a pharmacy to that was really that first introduction into what we see as Medtail today. Over the years, it has continued to develop and grow, and the services that are being provided have expanded quite a bit. Medtail doesn't just refer to straight medical or even physical medical services, but it would also include mental health and other services, dental health, skincare, just all the different things that are surrounding what we probably would call health and wellness today. and we have seen those services grow from that local grocery pharmacy to maybe CVS having their minute clinics, or Walgreens has something similar, to now they're growing into a more health hub oriented, where you could actually see a physician's assistant or a doctor at that location. Um, Walgreens has the same thing with Village Medical, and we've seen that begin to expand even further, where health systems are actually starting to have branded health system spaces in retail strip centers, where they are offering the services that typically would have been provided at a big medical campus. And that at times was intimidating to people, and now they're starting to bring those services out to the more suburban areas, out to strip retail centers, where they're more accessible and more convenient to people. Part of what drove this was the um, years ago, everyone talked about the retail, in the retail world, everyone was talking about the retail apocalypse, and really it was the emergence of online retailing and digital retail that they thought would drive out physical retail in the world. Well, that didn't happen, but it did create an overabundance and helped to create an overabundance of physical retail space in the United States and in the world today. And then, of course, the COVID-19 pandemic um, took a toll on retailers as well. And so today there is an abundance of physical retail space, and in part, that abundance of physical space and favorable lease rates are what is really driving the emergence of Medtail as a trend today.
So we talked a little, Medtail is kind of the decentralization of healthcare into the retail environment. Mark, do you have anything you want to add to that definition? You think that nails it?
I think that really kind of covers it. Even looking from the health system standpoint, it was, driven by convenience, and hospitals and health systems know that their campuses are not always the easiest to navigate, and they're working on steps like that now. But they definitely see the need for making convenience and easy access. That's kind of all tied together here.
So one important thing I forgot to say as the moderator, I had one job and I didn't say it, was that ask your questions through the Q&A portal. If you type those in there, I will actually do that part of my job and read the questions and filter them into the conversation. So that would be helpful. Put those in there, and that's how we'll get your questions answered throughout the presentation, throughout the conversation. You don't have to hold those until the end. So we defined what Medtail is. We talked about it as the decentralization of healthcare into the retail environment. But Mark, why is this happening now? Pharmacies have existed forever. Without this happening, what's pushed this recently?
I think there's probably a couple of things that have kind of pushed this. For at least from the healthcare end, I think one of the first places we saw this was with the community hospitals, and then kind of some concepts that were kind of bordering on Medtail, where they would have a surgery center attached to a community center and a fitness center, and community space basically where people could go and kind of gather together. Again, being closer to, but really from the health systems standpoint, what's driving the need now is cost. You look at building a large acute care facility with a lot of inpatient services. It's probably, especially with escalation right now and inflation from a lot of the things that are happening now, we're in the probably $400 to $500 a square foot range, where, with some of these existing retail locations or even building new, it's much more effective for them to build. And then, they found that a lot of these services that are provided in hospitals and have been historically don't need to be in the hospitals. They can push them out a little bit. So that's a big driver from the health system standpoint, is cost, and then again, convenience.
So why do you think that is? Why is it less expensive to build in a retail environment? What's different?
Well, for them, dealing with hospitals, you've got patients basically incapable of moving themselves out, and so in order to make sure we're protected in the event of a fire or some other disaster, we have to build the facilities more resilient so that we can physically move people with staff, so they remain safe. And that's an expensive thing. The other thing is, historically, they've wanted all the healthcare services in one spot, so it was easy for someone to come and get an X-ray and get some additional care, or move into the hospital if they needed to, and that was the concept for a long time. And so we're in an urban setting. It's expensive. Land's expensive, and so they would typically build up, and you'd have tall buildings that, again, supporting folks from moving on. But it 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 definitely, I think their mindset's been changing over the last couple of years. COVID's accelerated that a little bit. We'll get to that a little further down.
I'd like to chime in just from a retail perspective on why there is a buzz right now in Medtail. And you talked about it partially, Mark. From a healthcare perspective and a health system perspective, those spaces that are getting pushed out into retail spaces right now that are associated with health systems, those were all the reasons you just gave, are all the reasons that is an emerging trend. But there's also another side to Medtail, and that is really just health and wellness related experiential retail, is probably the best way to describe it. And it could be anything from a mineral float spa to a Himalayan sea salt sauna. Those are all concepts that I have seen that deal with just health and wellness in general. It could be a physical therapy location, or a chiropractic location, or anything else that isn't necessarily tied directly to a large health system. But there has been a huge trend over the past several years in retail to go from just simply purchasing something, a product, to retail that is experiential, where you actually go into a space and you do something within that space. And we're seeing that customers want a health and wellness related component in retail. So I think that's part of the emergence of Medtail right now, is that there are health and wellness related services that are popping up in these spaces right now. And really that abundance of physical space and favorable lease rates are helping people to experiment with different concepts right now as well.
A couple of good comments on here. One of them was a joke I made earlier to Jason, that these are being driven by young people like us, right? And we're not millennials. That's a bad joke, but the comment was, I think this is driven by millennials. They want convenience. They don't want to wait for anything anymore, and there's instant reinforcement and technology integration. Can you guys talk about that concept?
I can definitely talk about that, and Mark, I'll let you chime in also. I have written several articles talking about retail trends, and one of the things that I love to focus on in some of those articles is that retail is changing, and what is changing in retail is the definition of convenience. So people over time will decide what convenience is to them, and that continually changes. And you're exactly right that part of what we're seeing in Medtail right now is people determining that convenience is having that service located close to them, also close to other things that they are normally doing. And you're exactly right. One of the things that we'll touch on in a little bit is how data is driving. And we're seeing big tech companies big tech companies and big companies overall purchase things like health insurance companies. CVS purchased Aetna. Amazon and Walmart and other big tech companies have made pushes into the healthcare arena, in part to help ease the transition of data from one location to another. So your data will flow seamlessly, and you will have consistent applications, consistent phone apps, personal device use that allows you to just have a better experience with your health and wellness.
Well, from the healthcare end, I'm sure most people have experienced this at some point, but waiting, right? Always waiting. I think of my primary care physicians at a large hospital campus, and I would go out as far as I need to do to get the first appointment of the day, because I knew I wouldn't have to wait. Where you come in the middle of the day and there's been 2 or 3 appointments that have gone long, and we're seeing that now, and it's really been interesting because for the longest time, health systems and the physicians didn't want to do anything about it, and that's I don't know what was driving that, but they just didn't. And something we're seeing now, and we have seen this actually through some of the more kind of flexible and innovative physicians we've worked with. It's all done through an app, and so we're going to talk about that some more with this Medtail concept. But they know when you're on site, they know when you leave your house, they're ready for you, and there is no waiting. Or they can tell you, hey, somebody's ran long, come 30 minutes late. That's definitely something that's helping that.
So we're getting a lot of good comments, and I appreciate it. I'm going to filter these into the right section. So there's one on what type of regulation covers this, and I want to do that in the next section when we talk about what makes these projects different. Someone had a comment that said retail spaces in empty big boxes, empty anchors, and even small tenant spaces are cheaper because you have the existing bones there. The regulatory reviews are easy, and the time to market is quicker, and it's convenient. They have the right location. So I think that's a good summary of some of the things you said, but does that bring up any thoughts you guys want to touch on?
It does bring out some thoughts, and in the quote there was location, location, location,
Mhm.
and that's a huge term in real estate, but it is true for Medtail as well. And what we're seeing, we talked about data a little bit, and retail is driven by demographics and data. Retailers will research till the day is done what location they want to be at, what are the demographics within the location, what products and services do people in that location need. um, you talked about millennials earlier, Dustin. I did see a graphic recently where the demographic for Medtail that's driving Medtail right now are people ages 36 through 50. So it is my age group that is driving those services right now, probably because I'm getting older and I need those services. But it is one of the driving factors. But I also, people who are 36 to 50, and I'm making broad general strokes here, probably are a little less dense urban. They probably have started to move out into the suburbs a little bit. And so that's what's driving some of this emergence into retail strip centers and things like that. It's going to continue to be interesting to see how medical systems or individual entrepreneurs start creating services that are Medtail related based on those demographics. And we're aware of companies that may open dialysis centers in certain areas, but are going to do some other service in a different area based upon those demographics. And I think we're going to continue to see a customization based upon localized demographics, exactly like retail does right now.
So one thing I was thinking about before is that a lot of retail space is built around a speculative need. And I was curious if you're seeing that yet. Like, are people building mixed use developments assuming a Medtail component, or is it a lot of infill of older buildings like an old Circuit City or something like that?
Yeah, that is a great question. Right now, it probably more is the latter, where there is enough available space and it is cheaper to go renovate an existing space in a good location than it is to build a new space. But if I'm a developer and I'm building a new life center, which in the mixed use and retail world means that you are building a mixed use development where people live, where there's entertainment options and restaurant options, and where they are entertained, where they shop. So there's retail, but there's also life services provided there as well. And Medtail would certainly be one of those life services that would be provided. So in that instance, you likely are trying to build a speculative space for that, specifically for Medtail.
To sell the development, you want that type of a client in the development.
Correct.
Yeah. Another good question here that came in related to the the why, or is it says you can't have a healthcare store without a labor component. Is there a shortage of healthcare professionals to staff these? So pushing it out makes the staffing less efficient. Has that been a problem in your experience, Mark?
We haven't seen that yet, but obviously people have seen in the news what's happened in COVID. You know, you've had a lot of healthcare workers leave the industry, but we've also seen, interestingly, a growth of students entering medical education. You know, in the higher ed realm, and so um, it's probably a little bit of both. The other interesting thing is, depending on what this Medtail is, you know, think about some of these spaces like the health hubs. You know, they may not have a full doctor there, maybe a physician's assistant. And so I think that's one interesting thing about Medtail is you can get creative in how you staff these depending on your services. And you know, Medtail is so broad right now because there is just a number of different things that would kind of qualify for that. You know, something else that we're going to hit on probably several times is the concept of home health and bringing the care home. But you know, these folks are gonna have to learn how to help treat themselves or manage equipment or whatnot. And so Medtail is a good spot where they could go meet a technician and learn how this piece of equipment works that may be operating in their home. So it will be a mix of staff. And obviously there will be, you know, places where you will need a full, you know, MD, or you know, you've got your dentist or orthodontist, your eye doctors, but they will get creative, I think, in how they staff that for sure.
So I think that's a good definition, and it gives us an explanation of why it's happening. I think it'd be interesting to talk about the what, you know. So what are we doing here typically, Jason? Maybe you could talk about what goes into the design of a Medtail project, what kind of spaces are appealing, which ones aren't, what are the issues people are facing.
Sure, I'd be happy to do that. One of the things that I think is attractive, we talked about that there's available space and it's cheaper to go into those spaces because they're existing spaces that just need to be renovated. But one of the things, if you are a health system, that you don't typically do that you need to think about as you delve into Medtail is leases and lease negotiations and some of the early research that retailers always do that health systems don't. So that would be number one in my book is knowing what lease negotiations mean, what it means to have someone else in control of your utilities, for example, because you're part of a mall or a system that has centralized HVAC, centralized electrical systems. Learning how to negotiate those leases. Typically, what we've seen is that Medtail does not want to do the typical triple net lease. They would rather have a lease that's a shorter term with more money up front, and those are leases that landlords typically don't want to do. So right now, that is a barrier to the emergence of Medtail into a strip center is just getting on the same page where developers are comfortable working with health systems and health systems are comfortable working with developers. And I think over time we're going to see those things come together and continue to see these services offered. One other thing would be accessibility into a space. Accessibility and drive up ability, just access into a space is something that every retailer wants. But specifically, if you're Medtail and you are offering a service, say physical therapy, where people are injured and they're coming to you for a service to get better, you need to be located in a retail center where you have accessible access into your space. So I think that is certainly a key. The other thing would be just how the layout of the space happens overall. There's definitely a difference if you are a health system and you're looking to go move into a more retail environment. There's differences there, but if you are a landlord and you're typically dealing with retail, there's definitely differences between your typical retail space and what Medtail is. And I'll speak to it on a retail perspective. Typically you want a storefront that's wide open. You want to be able to see to the back of the store. You want to draw people in and experience your brand. And what we see with Medtail is typically there's still HIPAA privacy, there's still consultation rooms or service rooms. So there would be a space, and up on the screen we see the SpiroCare photo. That is a great example of what that is, where you have a welcoming entry into the space. It's branded, people can see it through the storefront, but then there is access to those individual rooms in the back. So a Medtail space typically is much more chopped up than what a traditional retail space would be.
And to kind of add on to that from the healthcare perspective, Jason kind of touched on HIPAA. We've seen a big change in that. And in fact, the FGI guidelines, which are kind of what drives how we design spaces in healthcare, are coming out with a major update in 2022 for outpatient and residential style facilities that have healthcare treatment inside them. And a big focus of it is going to be on acoustics and really kind of driving home that we're trying to make that space as safe for the patients as it would be inside a hospital. And so we're going to see quite a few changes there. And in fact, I think even on this project that's on the screen here, we did bring our acoustics expert in to make sure that the different spaces were appropriately protected. Another thing to kind of consider from the healthcare aspect, these large systems are used to building, fill very large, complex facilities. They're used to their own standards and their own guidelines and specific equipment, and that's something that's definitely been a challenge in helping them understand, well, if you're going into this retail space, you may not be getting your top of the line air handling unit. You may be getting rooftop unit that's 20 years old or 15 years old, and helping them understand that maybe they just don't need that for the services that are being provided in that space. And not just that, electrical service upgrades that may be needed if they're providing, X-ray, radiology equipment, things like that. So we've done a lot of education, I think, with the health systems, which has been super helpful with Jason and his team, to help them understand why things are a little different here, and why we don't, necessarily need the level we would need in a hospital.
It's interesting, Dustin, because Mark and I had this conversation as we were prepping for this webinar, that we both have worked at Henderson for years, but we rarely were working on projects together or collaborating because our worlds were separate. We worked in different arenas. And over the past several years, we've had the opportunity to work together a lot more because we need that expertise from both angles to really make these spaces what they need to be to serve our clients' needs. One of the things that is interesting is that healthcare systems want what we call in the retail world brand loyalty, right? They want customers to always come to them, or patients to always come to them. And they typically will do that by controlling data, by having all of your medical records, making it easy for you to go to a doctor and a specialist within the same health system, your records transfer, they create that brand loyalty. Well, in retail, brand loyalty is built on brand recognition, consistent brand message, brand trust, and customer service. And as medical health systems have been moving into the retail world, customers are demanding more of those things. And so we're going to continue to see that blend. And I think both arenas can learn from each other, and in the end, provide better services, better products, better brands, better everything, because of the collaboration that Medtail has begun to brought into our industry. A final thing is it's going to be interesting to see how healthcare professionals and health systems begin to interact through social media or digitally with people, because that's something that retailers do really, really well, is they interact with people through either social media or an in-store app or their brand app. And I think we'll continue to see the development of those ways to communicate with people through Medtail and through health systems, because people are just getting used to communicating digitally through their personal devices.
Yeah, that's a fascinating subject we could spend a lot of time on. Is just the digitalization of healthcare and the digital transformation of healthcare. Somebody used the analogy when I was talking to them about us as an engineering company going through digital innovation, and it said, you could try to be a really fast caterpillar, or you could be a butterfly. And I'd like the first step, and I feel like healthcare has kind of gotten to the really fast caterpillar stage. You basically have digital paper documents, but it'd be interesting to see what it really looks like if it transformed into something bigger than that. I want to clean up some of these questions and comments we're getting. A really good one I want to throw to Mark here is, our Medtail spaces covered under FGI or AIA guidelines, and specifically for waiting rooms, procedure rooms, etc.?
Oh, for sure. I think, I hate to say this, but all the states treat these things a little bit differently right now. And I think because Medtail is new, when we've gone into new jurisdictions with some of these concepts, there's been a little bit of hand holding, I think, and some education from us, the architect and the owner, as we help them understand what's going on. I think for the most place, I wouldn't consider Medtail any sort of, an inpatient setting, or maybe even setting where they're really even, putting people under with some sort of anesthesia. But that being said, I think it's pretty, a lot of these folks, especially if it's tied to a health system, are probably looking for some reimbursements from Medicaid and Medicare. And that's going to pretty much throw you into anything. NFPA 99 is a reference standard there, the Healthcare Facilities Code. And the way that they define medical facilities is pretty much any facility that's providing treatment or care. And so that pretty easily would pull you into a lot of those things you would think about. Obviously, we're looking most of the time, these are looking at some sort of business occupancy. So things are a lot easier and cheaper to build in that kind of standpoint. But one other thing that this kind of makes me think about is just something that's helped drive this is, across the US, there's a number of states that have what's called a certificate of need. And basically, hospitals have to get that to prove that they need to build a new health system. And what we've seen over the years, because that basically makes it really hard and is often, a several year process to say you want to build hospital X across the street from hospital Y. They may not let you do it, or it takes several years of fighting, with attorneys and things. And a lot of states have started to deregulate that, probably in response to what we're dealing with, normally in retail. I mean, you think about a corner, you've probably got one retailer on one corner, another retailer on another, and another on the other corner. And so health systems, to kind of help drive down costs, are looking at that same thing. I could do this more efficiently. And so not only are you going to see more hospitals where they have deregulated the certificate of need, but also they've seen that, these Medtail kind of projects that's a good way to push care out that they don't need to put in a hospital that maybe doesn't have the same regulations or requirements that you would need to go through to get it through permitting.
Yeah, it's about segregating services out, not just building little mini hospitals that do all the services, right?
Yep, exactly.
Another good comment, I think, in here that kind of went back to something Jason was saying before, that, if we're redoing an old Sears, say, and revamping something that is a big empty box with a big parking lot, that gives you a lot of things that you said you need here. It gives you an opportunity for branding, right? That's a place to get your brand out in front of people. It gives you parking. It gives you drive up and drop off capabilities. So some of these are prime spots.
They definitely are prime spots. What healthcare systems will figure out and are figuring out is that they do need to be branded in a consistent way, that customers and patients will want to see and feel a similar experience, no matter if they go to the big box that was converted into a Medtail space next to them, or the one that's across town. And so having a consistent experience, both just physically a patient experience, but also a branded experience, is going to be important. And that's really where the design team comes in and can really help a health system who isn't usually used to doing things like that, help them to think of the things that they may need to do colors, branding, consistent lighting, all those different things.
And I think there's a difference too, right, Mark? Like there's Medtail that is, adding some healthcare services to a retail environment, and there's like a ambulatory surgery center that's different, right? And that's more of the small hospital than maybe some of these other adding some healthcare component to a fitness center, right?
Yeah, no, for certain. And I think that's something that we have seen come out of COVID. A lot of the areas that were hit very hard and with what lots of patient surges, they didn't want, if you had to get stitches, they didn't want you to come to the hospital, right? They wanted you to go to an urgent care or the freestanding ED or, some other care site that wasn't in the hospital, because they're trying to keep the sickest of the sick inside the hospitals. And, when you do add that component, that ambulatory surgical center, it is closer to a hospital, right? You have people that are incapable of moving themselves in an event. And so we do treat them a little bit differently, but same thing happened during COVID. We saw surgery centers kind of became the shining light for hospitals because they could basically say no COVID patients in a surgical center, shift their patients out to the surgical center to get procedures done so they could keep people getting healthy and maintain the COVID patients inside the hospital. So we're going to continue to see that trend for sure.
Yeah, I mean, some of this, there's a business reality too, that surgeries keep healthcare systems going. And so you can't just stop doing that. And so that gave a system a way to diversify that out from their main campus and keep doing it. All right, another good question here. We talked before about technology and digital transformation. How do you guys feel about the impact of telemedicine on Medtail?
It's big, right? I think everybody probably saw in the last year, I think Teladoc and some of these other services, I mean, their revenue went from, 50 million to a billion, in the span of 12 months. And not only that, but you saw some of these other folks, Walmart, Amazon, that are starting to offer virtual care. And there was definitely, at least for the health systems, a little bit of a change. They needed to find space. They had a lot of the technology probably set up to do the virtual care, but getting reimbursement and all those things, that's been kind of, or it's on the way to getting sorted out through legislation. But I think we also saw there were a lot of probably people that were scared of doing a virtual visit, and maybe it's not going to be beneficial. Maybe they won't solve my problem. And I think the pandemic forced that to happen, and I think people are looking at it in a different light. And hey, I can just FaceTime my doctor real quick and get a second opinion or whatnot. And we're going to continue to see that. And I think most of the Medtail programs and startups that we've been working with, there's going to be some virtual care component associated with all of those. And so just making sure we have space, again, related to acoustics, and then just having the technology capabilities to deal with that, I think is going to be very important.
I think technology overall will have a huge impact on the future of what Medtail will become. It is a quickly emerging and quickly changing market because they're learning what works. And telemed is one of those things that, Mark, you talked about how the pandemic changed that. There's a buzzword in the retail community called omnichannel, and it refers to a brand having the same experience, whether you call customer service, whether you deal with them online on their website, through the phone app, or in store. And it's a seamless integration of all those things. As medical health systems move towards spreading out their services and diving into Medtail, you're going to see those same things. Customers and patients are going to want those same type of services and that same type of experience. And so I think the future is going to be interesting. I think we're also going to see different services begin to create synergies with one another. And so you'll start to create partnerships, or realize that you want a teeth whitening Medtail space close to an orthodontic Medtail space, and that it drives business for both if they have close proximity to each other. Things like that, I think, are going to continue to happen.
wanted to expand on what Jason was just talking about. Something else we've been seeing in the healthcare world is what we call the whole health concept, incorporating mind, body, and spirit. And I think Medtail is a perfect spot for that in kind of creating those synergies that Jason mentioned. You've got your fitness studio, your yoga studio, healthy eating, maybe a rehab space, maybe some outpatient clinical space. And, we're seeing that already pop up near hospitals, but that same concept we've seen, in mixed use development, or it becomes the mixed use development. And so driving that concept of whole health, the insurance companies have started pushing that harder now, and same with the health systems, because they know if they keep us healthy, we won't get to that point, or we won't go to the actual hospital unless we really are truly sick. And they see the need to help develop that in the community and public health in general.
Something I think is interesting is, as a design community and just as a world, we're great at responding to what's happening right now in the world. And so, everybody reacted when we all went remote and things shut down, and we did a good job of working virtually. And now everybody's coming back into the office like, okay, great, we can get back in the office, but it's not like it was. It now has a virtual component. So when you build Medtail, do we need to plan on a patient coming in and seeing a remote doctor, or a remote doctor seeing a doctor live seeing a remote patient? And do you have TV studios or rooms with TVs? Like, we need to start thinking about the hybrid mode of virtual plus in-person healthcare.
No, absolutely. And I think, kind of touched on it earlier with the concept of just technology and apps. I mean, we've seen, the benefit of going to a place like Spira Care on the screen. You let them know in the app you're coming. There's just no waiting. They know you're there. You can go right in. Maybe you're staring at an iPad, and you're seeing a doctor that's actually located at a hospital or across the country. We've seen that through a number of times, and we definitely know technology is going to be huge in this. And then I think something else that we're seeing now is with all these startup companies that are also looking at Medtail. We're seeing a challenge and a change in equipment that's being used. No longer are we just trying to do status quo of what's happening, and you need to go to the hospital to go do this service, or you need to go to a dialysis center to do this service. Well, maybe they need to change that. Maybe we've got companies that are looking at trying to get equipment, listed through the FDA to treat some of this stuff at a Medtail location, at their home. It's just, we have to be flexible, and we have to design these spaces to be flexible for what's going to change, because you just never know what's going to happen. And I think, we'll talk about this a little bit, but us in the healthcare industry saw this back in 13, 14, when the Ebola outbreak was kind of starting to stem out. And so I bet most of the health systems we work with at the time started looking at an airborne infectious disease unit, or a couple of rooms, or something to do with that. Well, that, we were able to shut that down so fast. Everybody scrapped those plans, to do those renovations or build new. And then here we are last year, and everyone's like, man, I need more, airborne infectious disease, negative isolation rooms, and they didn't do it. And so hopefully another thing we've learned here is to be prepared, so we are flexible for the future, and just making sure we can handle anything that's being thrown at us.
Do you want to add anything to that, Jason, before I go on to another question?
I don't know if I have anything specifically to add to that. You can go on to the next question.
Okay. So it says, within a big box conversion, will we see common areas and other activity areas that could reduce the need for large and efficient waiting rooms in each individual Medtail space?
I would say yes, and that is the perfect lead into one of the thoughts that I had. I just jotted down that I think I mentioned synergies with different companies, but what I think we're also going to see happen is Medtail will follow some of the same trends that retail is currently experiencing, and one of those is the store in store, or the pop-up. And that it's similar to a synergy, but it's a larger store. So maybe a big box is converted by a health system, but then they start leasing some individual spaces, or subleasing out some individual spaces to smaller Medtail service providers that just complement what they're doing. And maybe it's something that isn't related at all with the health system. Maybe it is a hot yoga place, or a mineral spa or something like that. But it's a service that people want, and that health system, that bigger tenant, wants to be connected to their branding and the overall services that they provide. So I think we're going to see that. We talked a little bit about speculative space earlier, and I think what we're also going to see as a natural trend is Medtail is experimenting in those retail spaces right now because of the favorable leases and the existing space, and we talked a little bit about that. But as these trends become solidified as normal within our society, and people expect those services to be provided, and it's not just convenient, it's now an expectation, we will see these concepts, Medtail being prototyped, and costs starting to drive down because they're looking to build new buildings in certain locations that are prototyped to specifically what their wants and needs are and the services that they want to provide. That in turn is going to allow us as designers to help them be more cost effective through things like prototypical design or potentially modular construction or other things like that.
So we've got about 10-ish minutes left in the conversation. So if you've been sitting on a question, now would be an excellent time to type it into the chat and we could get it answered. In the meantime, I just want to throw this out. Can you guys talk through just trends that you see, like what's next? We talked a little about the TV studio and a Medtail, but what are some other things you're seeing?
I think for us, two big things that we see coming, and it's here. Home health, bringing care to you. We talk a lot about a lot of the folks that end up in hospitals are dealing with chronic conditions, and nobody, even though we've done a great job in the last 25 years of making healthcare facilities, look and feel, natural light. It's not the institutional feel that it had, a while ago, but being at your house will probably make you heal better. I mean, so many people are comfortable there. So if we can find, again, new equipment, new ways to treat you at home, I think that would be good for the chronic conditions. And then, we're already seeing some of these larger companies that are trialing, sending out someone. So you call and this virtual care place has a staffing group, and they send someone out, and you just get your stitches right there in your home. You don't have to go anywhere. And I think that's a huge thing for what we're going to see with home health. And then talked a little bit about this earlier when we were preparing for this conversation about electronic health records. Obviously, we've seen most of the large health systems get to that point, and there's a huge debate now. Does a person, can a private citizen get access to that and control that? And we're getting there. I think that's something else that's come out of the pandemic, is we're seeing a lot of conversations happening between health systems, and ways to do that appropriately without violating any sort of HIPAA act, or that's going to be a tricky one. There's a lot of political red tape there, I think, that they're going to have to get through, but I think people want that kind of control over their own health records. I mean, and then price transparency at hospitals. We talked a little about the certificate of need, but healthcare is expensive. I think in 2019 it was almost 18% of our gross domestic product in the United States, which is very expensive. And so ways to drive that down and give patients more control over where do you go for care? Why did you choose that? Those are a lot of things that aren't happening right now. They're being talked about. And in fact, there is a transparency rule that's supposed to take into effect, and health systems just aren't complying. So we've got to drive the change at our level to let, again, continue that convenience and give us control of our information as much as possible.
I was thinking about that earlier, that right now an NFT is like you buy an NFT of a cat video for $30 million or whatever, right? It's kind of a silly thing, but that could be eventually a way that you create a token around your health records, and you're certifying that you own those records, right? You own that token. So there's technologies that exist out in the world that make it possible to digitally certify and authenticate your record and carry it with you between providers. That wouldn't surprise me if that became a thing. I don't know if I'm responsible enough to manage that, but we'll see. Jason, you got any thoughts?
I think you touched on one of them. I think there's going to be technological advances that are going to make services easier to render, which will create more opportunities for Medtail versus a larger health system. And I think that those services are also going to create greater access to care, but also more competition, which should hopefully drive down pricing of those services. So technology is one of those things. I think we will change how we interact with our healthcare providers. And I believe that Medtail is the beginning of us really having a more day-to-day contact with just the healthcare community in general. Um, I will say we've focused a lot on Medtail through a health system. Medtail, and we did talk about this, could be a whole lot of things, but I've seen concepts of we work on a concept called Modern Animal. That's a veterinary clinic that is very much a Medtail retail-esque type of place that is technologically advanced. They're very up to date on being able to track things mobily, but it's a veterinary clinic, but it's really centered around health and wellness, not just reacting to something that's wrong with your dog or your cat. So I would consider that Medtail as well. It's very, very similar.
Yeah, someone had a good comment that the trend is definitely towards keeping us healthy as opposed to curing us. And I think that's one of the things driving this convenience and decentralization of healthcare, is just making it easier to stay healthy, not just get cured when you have a problem.
Well, I think we have a great example, kind of maybe even just to kind of wrap up on. You think about Walmart Health and their creation of these clinics, and you basically the ones that we've seen have been basically just attached to the store. And was talking to an architect we were working with, and they talked about how their daughter dropped off their car for an oil change, went and did the annual physical, did an eye exam, was able to pick up glasses and everything, sort that out right there, and then went grocery shopping, got back in her car and went home, and did so many things that most of us do on a daily basis or a weekly basis, never left one store. And I think that's entirely what Medtail is about, just that convenience and, just keeping it simple. And there was no drive into the hard campus that you couldn't find anything, couldn't find a place to park. I mean, it just was a great thing, and just a great example of why we're driving this forward.
Jason, you have any closing thoughts you want to add? You might get the last word.
You know me, I don't want the last word.
You want the last words?
No, that was a good summary story, and I think you're right, Mark. That convenience is what is driving this trend. It's going to what continues to drive the trend, and it's what will change what the trend is over time. And I'm excited to see what that means for the future, because I think it's going to be a better service and better access for all of us.
Thank you for your time here, guys. I appreciate your expertise on this. And thank you for the people that dialed in and spent their lunch hour with us talking about Medtail. I think that wraps it up. So we're going to go ahead and end the webinar. If you have questions that you feel like you didn't get to ask, you can see our emails here. You can email any of us, and we'll do our best to be helpful. So thank you for your time today. I appreciate it. Take care, everybody.